You're listening to the Autism Weekly podcast. Each week, we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Kupzyk. This week, we welcome Dr. Lerman, who is currently a professor of behavior analysis at the University of Houston, Clear Lake. She directs a master's program in behavior analysis and serves as director of the UHCL Center for Autism and Developmental Disabilities. Dr. Lerman has published more than 80 research articles and chapters, served as editor-in-chief for the Journal of Applied Behavior Analysis and Behavior Analysis in Practice, and has secured more than $2 million in grants and contracts to support her work. Dr. Lerman joins us today to share her experience in educating dentists and police officers about autism to help them serve the autism community. Dorothea, welcome to the podcast.
Well, thank you. I'm delighted to be here today.
Well, I'm excited. I'm excited to pick your brain on so many of these subjects. But before we get there, empowering community stakeholders, especially the ones that you're working with right now, there must have been a reason that drove you to say, there's a need here. There's something that I have to be doing to fill this gap and to educate. Where did that passion come from?
Well, I really wish I could say that I led that effort. I have to admit that in both projects, both cases, someone came to me. And the first one was with the police officers, was the passion of one of my graduate students. So we have a 3-year master's program, and in her very first semester in the program, my student Carly Hinkle approached me, and she told me that she had been reading on the internet about a young man with autism. I can't remember what city he was in, and he was just hanging out in a park, minding his own business, playing with a string, as some individuals with autism do. And a police officer who was driving by thought he looked suspicious and strange. So the police officer, and all of this is picked up on this police officer's body cam. It's on the internet. You can just Google and find it. And within 5 minutes, because I looked at the clock, the video goes and you can see from the very start, within 1 minute of approaching this young man, he had him tackled on the ground. And he actually, this young man had bruises and had to get surgery on his toe. So what happened was he approached him and started trying to talk to him. And the young man got nervous and started backing away. And it was simply the fact that he backed away from the police officer that caused the police officer to immediately physically restrain him on the ground. And Carly was absolutely horrified, and she said she wanted to make sure this never happened to another person with autism again. And so I said, well, this is something you're really passionate about. I know nothing about this, but I will help take that journey with you. And so that's what got us started in that area. And then what got us started training dental students and professionals, as well as medical students, which is what we're doing now, was we were approached by a university-based clinic that's amazing. It's one of the few in the country. It serves as a medical home. It's interdisciplinary and serves as a medical home for adults with intellectual and developmental disabilities. And they had gotten a grant. Ironically, they don't have a dental program, but they had gotten a grant to create a training for dental students and professionals, as well as to provide behavioral intervention services to patients who were required to be either restrained or sedated to have any kind of work done. And so they partnered with a local dental school and then realized, well, they need a behavior analyst to help them with the behavioral interventions. And so they contacted us. So in both cases, I became very passionate and very interested in the topics, but I am embarrassed to say that that passion didn't, and those ideas didn't directly come from me. It came from me, other people suggesting it to me.
Yeah, but at the same time, you're definitely there to be able to help support Carly in her mission too, which I think is part of the big piece to this, is that we don't know what we don't know. And even what you're talking about with dentists is that we have a parent portal where it's just like this parent feedback where they can communicate with one another. But you look at the questions and you start to kind of evaluate what are the big things that parents are concerned about. And I think you hit it. I mean, it's right there. It's how do I give these normal opportunities that we all go, not that we all want to be at a dentist, but that we get to access, and make it so that everybody has that same opportunity, whether you're neurodiverse or if you're neurotypical, whether you have a disability or if you're able to access more environments independently. It's how do we create that more inclusive community? But
Yeah,
I want to go back to the police
I'll say
officer.
I had no idea until we started looking into the dental project, the extent of the health disparities that
Mhm.
individuals with developmental disabilities experience. And once I realized that tremendous health disparities, that's what really drove us. Because there are so many families who say that they can't find a medical or dental provider who will provide services without requiring some type of sedation or restraint. And I
Mhm.
may be jumping ahead, but and we'll get back to the police officers. But what we found in our initial work is that about 50% of the patients whose dental providers were saying they had to be sedated or restrained were absolutely fine with very minimal support,
That's
absolutely
amazing.
cooperative.
Yeah.
So we were so alarmed. We quickly published those data before we were finished because
Mhm.
we were so alarmed that this meant there were a lot of people who are being unnecessarily sedated or restrained. So I just wanted to make sure I got that out there.
No, and actually, let's stay there because it's honestly one of those things that there's some momentum here for us to be able to chat on this piece. But on the dental piece alone, I've seen a variety of clients of my own that I know are in pain. I know that because of the lack of dental care and their families' hesitance to take them. And it might be because I don't want to go and have to go through sedation. I don't want to go and have to deal with a battle that entire time. But just hearing about it afterwards and being able to kind of help support through that, that child, that individual was in so much pain for such a long time. And we all just contributed to, well, it's just part of their behavioral, like we didn't look at that medical piece to it. And building that community is so important. What are the components that you look at? I mean, the assumption is, well, we have to sedate everybody, and that's the old assumption. What are the pieces that you're actually training a dental office on? I mean, there's so many working operational components. Like, where do you even start?
Yeah. Well, we started by looking at the literature, and what we found was that a lot of the interventions that have been evaluated are ones that would be too complex and time consuming for dentists to implement within the context of routine dental exams. So we said, okay, what we're going to do is we're going to start out with what we consider to be what we can call best practice package. That is a set of procedures that we think most dentists should be able to implement. And so, in addition to sort of building rapport and making sure before you start that the individual feels comfortable, we recommend things like um, providing access to a highly preferred item that they can have throughout the appointment. Often that might be an iPad or something they can watch a movie on, or something they can hold or manipulate. Um, Something that all dentists are taught. In fact, the only thing dentists are taught is something called tell, show, do, which is where you explain what you're going to do, you show them, and then you do it. And so we included that because that is something that dentists are taught to do. Praising compliance, right? And giving frequent breaks. And so that's sort of a package we felt that most dentists, and we had dental professionals on our team, and we felt that, and they agreed that most dentists should be able to do without unnecessarily lengthening their appointments. Obviously, they're going to be a little bit longer, but that's something that should be accommodated for someone. And so those are the main interventions that we teach dentists to do, with the understanding that this isn't going to be effective for every patient. But our research suggests it's effective for 50%, right?
Oh, absolutely.
And then if they need something more, then they could be referred to a behavior specialist who could do the more intensive things, which typically involve very gradual exposure to the steps. And one thing I do want to mention is that we recommend that all dentists, if the patient does become disruptive or resistant, they should back away, right? They shouldn't force anything on the patient, because that's just going to make things worse in the future for that patient. It's just going to be even more aversive for that patient.
Yeah.
So, yeah.
But even that step, I mean, that's a bridge of where treatment has gone over time. Is just the idea that somebody during a dental procedure still has the ability to assent or withdraw assent during that process is pretty important. I mean, if I was getting something done in my mouth, is that I could voice that. I could say, no, I think I'm done here. And they'd have to listen to me. They'd have to follow that process. So being able to train on that is so important. So you've done this within, it sounds like, an amazing partnership with a dental clinic.
Yes.
What's the community feedback? Are you hearing that, this is scalable? It's something that we can help to train to other community partners, or does it take that dedicated office to really put it into play?
That's a really good question, and we haven't quite gotten to that point. So we have, we developed a training for dental students, because the American Dental Association is now requiring schools that want to be accredited, they have to include the specialized training, and dental schools are trying to figure out how to fit it in. And so we developed what we hoped would be a nice, efficient, effective training procedure. And just as we were starting to put it together, COVID hit. But we thought, what, this is a great opportunity to look at virtual training. So like you and me will be role playing through the computer, right? I'll be presenting information, we'll be role playing through the computer. And so that was our first study that we did with 7 dental students. And unfortunately, because of COVID, only one of the dental students could we observe them working with actual patients. We did see generalized performance, and we did see that our virtual training was effective, at least in terms of them implementing the procedures in role play with someone else in their home. Because again, this was during COVID, so they had to recruit a volunteer, typically a family member, and we used a bug in the ear to coach the pretend patient on what to do, so that they could show that they could implement these procedures during a mock dental exam. So we haven't quite gotten where you're at, to the point you're asking about. But what we're trying to do, so when we had to pivot to telehealth, we have a behavior analyst that are coaching caregivers to implement the interventions in mock exams with their adult children. And once that's effective, then we're having them go to a community dentist who doesn't know anything about how to implement these things to see if it generalizes. And at least initially, what we're finding is it's not generalizing. Shouldn't be surprising, right? So clearly, we're either going to have to do something in those mock exams with the parent to help promote generalization to a community dentist, or we're going to have to start training a lot of those community dentists. Now, that's the goal, but we haven't quite gotten there yet.
Yeah, I mean, do you see that biggest piece being the ability to establish rapport and trust, and that carrying over? Or is it a matter of, the skills aren't there? Where's the biggest gap, if you were to make an assumption? I know it's not very behavior analytical to make the assumption, but if you were to make that guess.
In terms of the community dentists?
Yeah, and that transition into, I mean, if you've gone through the virtual and you've given the dental patient the chance to be able to experience this is what it's going to feel like, this is what it's going to be, and then you bring it into the community, where's the biggest variable that you would say, that's where I need to prioritize. And if I were to coach a practitioner, focus on this first.
That is a little hard for me to say. I mean,
Ah.
clearly they are successful with a set of procedures that are being used
Mhm.
during a mock exam. I don't, it's not clear to us what part of those procedures, because it is a package. And it's not clear to us what part of those procedures are most effective. And so that's the challenge. And that's, obviously something that we're going to have to study further. Yeah.
Mhm. I remember when the American Pediatric Association with their residency program went through and they started enhancing, we have to incorporate neurodiversity into our residencies. And it sounds like the dental world has followed suit. Is there much difference between behavioral skills training and kind of teaching them through the steps that maybe a behavior analyst would be following to be able to learn to be able to work with these patients and their typical teaching methodologies that, I mean, you explained earlier, which is kind of more of that observe or learn, observe, do sort of methodology. Was it an easy transition for them to kind of be like, oh, okay, I understand. I see the validity to this, and there's so much that I could be able to incorporate into my typical practice?
The feedback that we've gotten has been very positive. Now, they have expressed concerns about the fact that it'll lengthen the appointments. And so I'm not sure what the implications are for that, for their practice or for
Hmm.
insurance billing. But I think that that kind of accommodation we should be a right, right? So insurance companies should cover slightly longer appointments if that's what's needed to accommodate individuals with disabilities. So instead of just trying to find things that will fit within the typical 30-minute appointment or whatever it is that they allocate to all patients, there needs to be some type of allowances for these longer appointments.
Yeah, no,
Yeah.
absolutely. But that's also the hard part. That's where it's kind of you might have the most well-intentioned dentist out there. And as
Yeah.
soon as the community hears that they're great with being able to work through kind of more challenging situations or being patient with their patient and kind of being and giving them more of the time and the expertise, is that all of a sudden their panel starts filling up. And unless there is a reimbursement change to what's occurring, it becomes nearly impossible to sustain the model. And it's either you build a large network of people that are capable of doing it, which it sounds like you're advocating for, and you're trying to say, this is great for every resident to learn, every new pediatrician to learn, or something has to change on the structure of how we actually reimburse dentists over time.
Yeah, the fact of the matter is I would have to think that in the long run, it's going to be cheaper for insurance companies if these people do not have to be sedated or restrained.
Hmm.
So, particularly the sedation and the extra anesthesia that they maybe wouldn't normally get if, the dentist use these procedures might be a slightly longer appointment, but they don't have to do those more risky, expensive procedures.
Yeah, no, I mean that all of these things are so hard to kind of think through. But I mean, you're taking that first step of empowering people to know that they can, which I think is the most important thing, is to show
Yeah.
people there's another way. There's a way to be able to work through this. And you do this not just with the dental community, but it sounds like you've done this with parents in the past. It sounds like you've done this with teachers in the past. And the other big component right now, which your student Carly had brought to the forefront, is with those first responders, which could be police, but it could be fire at times, could be EMS. There's a variety of people, but when you're talking about police training, I definitely feel that challenge of trying to identify, is this somebody who's neurodiverse? Is this somebody who is out in public and maybe having some other challenges that are more temporary that are going on? How important is being able to understand how to approach somebody, identify if there is something that's contributing to their behavior before intervening? Is that one of the steps you're looking at with police officers right now?
That's a great question, and I'm so glad you asked it. It was our opinion, after reading many, many well-publicized cases of encounters between police officers and individuals with disabilities and how and why they went wrong, that it was our opinion that what we were planning to train the police officers to do is something they should do with anybody.
Mhm.
So it doesn't matter whether someone is on drugs, right, or someone has schizophrenia, or dementia, or autism. What we were training them to do, they should do, that we think it would be that it will increase the safety and cooperation of the person that they're working with. And so while we did definitely cover the characteristics of autism, we were not concerned that they could identify people who had autism from other people. We wanted them to be sensitized to anyone who may be acting a little atypically. Maybe they have autism. And so maybe they should think about what they had learned and
Mhm.
implement that.
Yeah, and it's
Because
funny.
yeah, really what the research was showing is that police officers tended to rush in too quickly and expect immediate compliance to their commands,
Mhm.
despite
Absolutely.
maybe an individual having a communication disorder, right? So we basically, and strategies to de-escalate problematic behavior. So an important part of partnering with a group like police officers is to get their buy-in, right, and work collaboratively with them. And so when Carly approached the largest police department in our area about doing this, they said, well, first you have to do a 1-year internship with us. And of course, Carly was a little bit like, really, I have to do this? But it was the best thing because it allowed her to get to know police officers, their terminology, their culture. It helped her get to know them. She got feedback on what she was planning to teach them. And it
Mhm.
was really critical to what she ended up teaching them and how well the training went.
Oh, okay. I'm glad Carly did that. I mean, we always look to be able to be mindful of everybody's perspective in any sort of intervention that we're doing. And if she is going to help support that community of police officers, it might, and it sounds like she took this advantage, really understand where their perspective is. Where are their pain points? What is it that they are fearful of before you start to change that dynamic too quickly? Um, but with that police officer training and the understanding of, there's so much that's going on, I think that speaks to that kind of generality of applied behavior analysis in general. It's that no matter who that person is that you're interacting with, these behavioral skills are so important for a police officer to really understand. So is your training that you're doing with them, even though it might be ASD specific, is it more ABA specific than anything else as far as like, hey, here are the concepts?
Yes, it sure is. So one thing that we did learn is that if the police officer felt that the individual was engaging in dangerous behavior, so dangerous to themselves or others, the police officer had to use the procedures that the department were teaching them about managing dangerous behavior.
Mhm.
So, but what we realize is police officers may not be adequately distinguishing between just problematic behavior and dangerous behavior. So that was
Mhm.
very important to help them understand by giving them lots of examples of, if the person is screaming or throwing things, but not at anybody, or just flopping on the ground, that's just all problematic behavior. That's not dangerous behavior. So that was one important thing. So once that was clear, the distinction, So basically, a lot of the ABA principles are things like, well, first of all, backing up and waiting for problem behavior to stop before you step in and start interacting with the individual, but always staying, pretty far from the individual, at least an arm's length away from the individual. When giving instruction, first, of course, building some rapport, talking to the person, introducing yourself. When giving instructions, giving it 3 different ways. So if you say, where do you live? You ask a question, where do you live? If the person doesn't respond, then ask it 3 other ways, right? Simplifying the language, using, if the person doesn't respond to vocal commands, using imitation commands, do this and show them sitting, model sitting down, praising cooperation or compliance. So really a lot of just basic ABA principles that should be effective with any person. Yeah.
No, absolutely. And I mean, it kind of attests to those that you're working with right now is that they're seeking that knowledge. These aren't easy things to go in and learn within a 2-week training period. I mean, it takes practice. It takes the ability to get in there. And I guess my mind immediately goes is that I think I was watching on television the other day a metaverse commercial for firefighters going into the line of fire, but utilizing virtual reality and things like that for exposure. Is there a role for that? Because as much as I could be told, this is what I need to do, this is what this child might do, this is that experience, without somehow being incorporated that where I've practiced these semi-real life situations, is there a role for virtual reality to be able to help these departments over time?
I think that's an interesting idea. It's a little complicated to program in a virtual reality platform. And actually, so what was really great is many police departments, many states require crisis intervention team training of all cadets and police officers. And in fact, in Texas, it's a 40-hour training. And so Carly embedded her training within that. And that training already uses like role play. So actors come in and they might pretend to be someone with schizophrenia or someone with Alzheimer's. And, they kind of role play and they get feedback from a trainer. So this hands-on training is something that police officers in surveys say they really want. And this is something that a lot of the CIT trainings do and incorporate. And so that made it really easy for Carly to incorporate that type of training in as well. I see the benefits of the virtual reality training, but, it might be easier and less costly to just have people who are pretending to be people with autism and other types of individuals, rather than trying to create a virtual training platform where you have to program in responses based on your response. Now, I'm not a tech person, so it might be the case that there could be a trainer off to the side who's quickly telling the program, now do this, now do that. And so I agree that could be a possibility. And in fact, most of the big ASD trainings for police officers right now are web-based trainings, but they're totally based on knowledge, not performance. And quite frankly, we just didn't think they really did a good job.
Yeah. And I mean, and that's, I think, in all walks of life, even when you look at the behavior analytic field, is that, you can get all you can from a course, but it's your fieldwork supervision supporting it that completes the package. So, I mean, it's going to be the same for police officers trying to learn the whole behavior analytic curriculum in 40 hours. I mean, not really, but that's what it probably feels like to them.
So all cadets and police officers have to do an initial 40-hour CIT training, and then they do annual refreshers that are 8 hours. So theoretically, one could make sure that at least once a year, these police officers get a refresher in the procedures. The other thing that Carly found and developed was a little, what we call a text prompt. So it's like a little card, a little laminated card that very succinctly had the steps that a police officer should take when they encounter someone in the field and they believe they might have autism or something else, or and they want to use those steps. And we kind of envision that it could be a card that they could have that they could just sort of pull out and reference when they're out in the field.
Yeah. So, I mean, what is when Carly went through this, and maybe this wasn't one of her questions, but I've heard it from police officers, is that they don't know facts about an individual that they don't know. So there is a role for self-advocacy in some ways. There's a role for parental advocacy or community stakeholder advocacy, whether that's somebody who knows that, I might have an episode in the community where I get very frustrated, and people might look at this as me having a dangerous situation, but this is just me working through something. I'll never hurt anybody. I'm not going to be able to explain that to a police officer at the time. Are there things that you're recommending to families as far as being that advocate, or to self-advocates saying, sometimes nice to have like a little card on you that you can just hand to somebody, if that's a possibility, or just little steps to empower the police officers to make the right decision at a time where they might not always be able to make the right decision or choose to because of time constraints or self-imposed reasons?
Yeah, most definitely. In fact, part of the police officer training was that they should look to see if there was a caregiver or someone nearby and the kinds of information to get from them. And certainly, we do recommend that caregivers have those measures, like maybe the individual having a card, right, that they could then hand to the police officer that explains what's going on. We haven't worked as much with families in terms of encounters with police officers as we have with the police officers themselves. But some of the things that we have done for families that are interested are teaching children with autism how to recognize someone who is a police officer and to cooperate with their commands and questions. Yeah.
Yeah. And I would imagine that sensory issues play a role, not just with the police officers or the dental situations, but almost any high stress environment. Is that even for me, sensory issues play a role in how I respond. And how are you working through teaching some of these first responders, some of these very critical people about how the sensory feedback that the person could be receiving, it could exacerbate symptoms of what's happening at the moment? Is that a big piece of this as well?
We definitely talk about that. And that's why we basically tell them to step back, right? So if the person is showing any kind of signs of distress, to step back and wait for them to calm down, and then to quietly approach them, but not too close, and try to build some rapport by introducing themselves, trying to then eventually, if they can get some cooperation, taking them to a safe place, a quiet place. So that's definitely part of the training.
Yeah, I'd be fearful in a first responder situation that I could be contributing to a problem by not being equipped to make those decisions. Where do you suggest that people go that maybe aren't part of the Houston Police Department that has all these access to wonderful resources, or the dental program that you all are working with? How do they advocate for, I need this training? My department needs this training. My organization needs this training. Where should they be going right now?
Well, I'm glad you asked that question. Autism Speaks website, they do have a nice section about police officers and training for police officers, as well as information for families. And so I would go there to look at. They've got some resources there as well. In terms of the dental and medical training, we actually have a website with some training video and materials that is we have 3 different ones, one for healthcare professionals, one for families, parents and caregivers, and one for home health aides. Now, before I give you the link, I do want to clarify that this particular website training is focused on vaccine administration. because this was a grant we got specifically during COVID when everyone was trying to get the COVID vaccine to help with cooperation and comfort for those administrations. But what we're training and teaching, you can use with any kind of medical procedure. And so that web link is www.uhl.edu/autism-center/B as in boy, A as in apple, I as in igloo, V as in Victor, A as in apple. And that last word stands for behavior analysis for inclusive vaccine administration. And so people can go to that website and download both an associated instructional manual and take a video-based training. And again, there's 3 modules. They should select the one that fits them.
Well, I appreciate the fact that you guys have been able to build this out, and just to have the resource as a starting point for so many different people. We'll make sure that we link that as well, so that if anybody didn't catch it, that it's there for them to reference. But you also, I mean, you're influential. You're influential within the behavior analytic community. You've done some wonderful research. You have started some research on this subject, which of course means you want people to be able to continue to explore it further. What are the questions that you walked out of the research saying, I think I'd love it if somebody took this and did eventual research on these 2-3 things that would help to expand the thought that's going into it?
Oh, we need a ton of research, and we are continuing to do that research. But, first of all, we need to figure out how to scale up what we're doing. So, so far we've published 2 studies with dental and medical professionals. And in each of those studies, there were 7 participants, right? And so that's not gonna cut it. Medical schools, dental schools, they are now being required to include the specialized training. And the question is, how are we going to do it effectively but efficiently? How are we going to get that into their existing curricula? So we were really excited. We got a 5-year state grant to do this. And so we are working right now with 2 medical schools. And for example, next month, we are going to train 200 medical students, and we've been given about an hour and a half. All right. So this is something we're studying, is what is the amount of training that is needed to get some skills so they can perform these skills. And so we've created a video where they're going to be observing someone implementing them and scoring that person's integrity. They're going to do some role play. And so that's something that we're looking at, but that's something that's going to take a lot of studies. And then looking at them actually working with patients, which we're not going to do initially because these are medical students who aren't working with patients yet. Same with the dental work, right? That needs to be studied too. And then, so it's not just getting into those medical and dental schools into their curricula, but there's also those existing professionals who are already out there practicing. And so we are actually expanding. So I mentioned this vaccine website, but that's actually going to be a springboard. We're going to be creating one that's more general for current healthcare professionals, where they can go and download instructional materials and then perhaps join virtual roundtables using very much the ECHO project model. And so, but this all needs to be studied.
No, absolutely. And the fact that there is the opportunity for CMEs in this in the future, I think is so important. It'll hopefully be able to drive people to get there. So, so Dorothea, where can people go if they want to see the research that is being done on this and to be able to kind of expand their own thought process to say, are there pieces of this that I should be incorporating into my practice? Do you have links to your work that people could be able to access?
I could definitely, so I do have a couple of articles, and I could make those available to your listeners.
I mean, even if it's a matter of knowing which journals to go to, or where at the University of Houston they can kind of read about what sort of research you've conducted so that they can start to explore it on their own. Sometimes getting that starting point is just as valuable as the end point of having the article in hand. So.
Right. So I don't have a whole lot in a concentrated place, but there's the 3 articles we've published in this area, the one with police officers, one with dental students, and one with medical students. And Kupzyk and Allen in 2019 published a really nice review paper in the Journal of Developmental and Physical Disabilities called A Review of Strategies for Increasing Compliance and Comfort with Medical and Dental Procedures for Persons with Developmental Disabilities. So I recommend that review paper as well. And then if you could make my 3 papers available through a link, maybe, I don't know if you have a website for your podcast.
We could definitely help with that. And I think also for not just the practitioners that are out there, the dentists, the police officers, or the parents, but I think also for the behavior analytic community who's going to be out there and has a chance to be able to help demonstrate some of these techniques, be able to model them, being able to help support during some visits until a dentist feels more and more capable of being able to take on some of those roles independently. All of that, I think, is extremely valuable. And I'd love for all organizations to be able to understand that, it's easy to be able to apply our science into other domains and to empower others to be able to continue to take advantage of it. So I'll definitely link that. And Dr. Lerman, I appreciate the effort that you've put into bringing a lot of this to the forefront to be able to talk about these issues, explore better ways to do it, but then also for coming on our podcast. So thank you so much.
Well, it's been great to be here. I appreciate the invitation.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Google Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.